So Dr. Mark Brown. He's a family physician in Moose Jaw, Saskatchewan, who focuses mainly on obstetrics and pediatrics. In 2007, Dr. Brown was struggling to keep up with his 2,500 patient caseload. After a conference that same year, Dr. Brown and his office assistant, Debbie Higgins, began their journey implementing advanced access in their clinic. Through their work on advanced access, Mark and Debbie have worked on such things as backlog reduction, redefining roles in the clinic, and redesigning common care processes. Dr. Brown has managed to achieve and maintain a calmer pace without impacting income, and currently has 60 to 70% of his daily visits available for same-day requests. Mark has expressed to me his wish to share his learning in advanced access with as many people as he can. I know he's happy to be able to share his journey with you today, and with that I welcome Dr. Mark Brown to share with us.
So I'm going to take you guys about 240 kilometers southwest of here, very wet kilometers southwest of here, right now down to Moose Jaw, which is not quite the academic University of Saskatchewan office like Jason was just showing. So it's a little bit more healthcare out there. Is a little bit more frantic. Sometimes a little more hairy. We don't have the university set up quite so close to be able to support us. I'm going to tell you a little bit about my experiences in Moose Jaw. I'm a family doctor, and I've been in Moose Jaw for 10 years now. And as Christina said, approximately 2 years ago, I was really struggling to keep up with the pace. We've got a department of about 24 family doctors for a service area of 50,000 plus people, and so everybody's got a fairly large caseload or panel. Do you guys know what I mean when I talk about a panel? Some of you. Okay, so I'll talk about number of patients then. Okay. Oh, and when I talk about advanced access, I also mean redesign. I kind of use those words interchangeably. So if I talk about the one, I really mean the other, and they're kind of interchangeable. So approximately 2 years ago, I was kind of at my wit's end, and believe it or not, I was actually thinking about leaving the province because I was too busy. And unfortunately, that's something that happens often in Saskatchewan, that family physicians get too busy. They don't know what to do in terms of getting their numbers down. You know what happens in the media when a doctor decides to let go 500 of their patients? It's suddenly on CTV News, and everybody's jumping up and down and mad at them. So what's happened in our community, and I'm sure what happens a lot in communities all over Saskatchewan, is that we have had family doctors move away just because that's the only way they could get their life to kind of calm down, is to leave and start again. And whilst I was in BC actually contemplating a move, which I'm really thankful that I didn't, I found out about advanced access, and I thought, okay, well let's have a look at this. I didn't really care for BC anyway. I was really happy in Moose Jaw. Moose Jaw is a friendly place. Saskatchewan people are great. And the people have always been awesome. And in the death of winter when it's minus 40, it's a really good excuse to go somewhere warm. So I kind of got into the whole concept of advanced access, and I'll give you a practice overview in a minute in terms of what my practice looks like and how we operate and how that transition happened. But I just kind of wanted to look at the bigger picture for a second before we proceed and talk about the national level and talk about doctor-patient ratio. I read recently in the Medical Post that in I think it was Barrie, Ontario, the people were bleating because there was a 1 in 1,000 family doctor to patient to population ratio, and 30,000 people didn't have a family doctor. It was just crazy, and my personal belief is that if everybody just embraces looking at the processes that they're involved in and how they do them and look at how they can improve them, and I'm not just talking here about healthcare workers, I'm talking about patients too. clients, I'm talking about the whole population, needs to look at how they're using the healthcare system, how we function in the healthcare system, and look at improving it, we can make a huge difference without necessarily shipping in thousands more doctors. I'm an IMG, and I don't necessarily agree with the process of recruiting thousands of people from outside of the country and taking them away from those other countries. But I certainly think that there's potential here for this at a national level, and that's why I express my willingness to the Health Quality Council whenever I get approached to talk, that this is something that I'd really like to promote, because I firmly believe that we're onto something here that can change the whole face of healthcare for the better without necessarily requiring huge inputs of human resources. At a provincial level, it's really heartening to see that through their dealings with the Health Quality Council, the provincial government is starting to embrace clinical practice redesign and starting to look at system improvement, and I think that that's fantastic as well. And I'm really encouraged by what's coming out there. And I will touch on, I'm not sure whether this is classified information, but I have got some information on some changes that might be coming in the near future that will help to improve efficiencies in office practice within the province, and that comes directly out of dealings between the Health Quality Council and people in the field with the provincial government, and then taking advice. And it's really exciting when you look at some of those things, at the improvements that can be made. From a local perspective, I think I've given you guys a perspective already on Moose Jaw, how many family doctors there are, the fact that it's really busy. But I'd just like to say that we're still really fortunate if you compare us with the rural areas. I mean, Moose Jaw is a regional centre. We've got lots of family doctors. We've got specialists. I think the real crisis in healthcare in our province at the moment is in the smaller towns where there's just an absence of healthcare workers. And I wish I could have an answer for that, but I don't. The other thing that is really exciting in terms of the provincial attitude is the fact that we can now talk about backlogs instead of waiting lists. Waiting lists was a nice cushy word, right? Whereas really you need to get down there and get dirty and talk about backlogs, because that's what it really is. And backlogs in the system are just unacceptable, and I think that advanced access is a way of trying to deal with that. Does advanced access work? And I know that there was a speaker talking about sustainability. Is it something that is going to be sustainable in the future? Well, I think that the key comes back to what I was saying earlier about whether the people who are involved in healthcare and the population are willing to change fundamentally the way they do things in terms of its sustainability. In terms of our attempts to change it by instituting advanced access on a practice-by-practice level, I don't know if that's sustainable. I think a lot more needs to happen. But like everybody's probably heard about the little guy who's walking along the beach throwing sea stars back into the ocean, and the guy comes up to him and says, well, what are you doing? There's a whole beach full of millions of these things, and you're throwing them in by one, and what difference do you think you're making? And he picks one up and he throws it in. He says, well, it made a difference for that one. And I think that it makes a difference, okay, even if you're starting at a small individual solo practice like mine.